This is the Chat City Interviews from 103.2 Preston FM with your host, Hughie Parr.
Now, Crohns and Colitis UK, I'm sure, welcome the debate that BBC coverage created last week in creating and generating an awareness of these often invisible inflammatory bowel diseases. But I think there was some concern about the reference to junk food, etc. And to discuss this more, I'm pleased to welcome on the phone this morning, it's Dan Mclean, and Dan is Director of Communication at Crohns and Colitis UK. So Dan, a very good morning to you.
Morning, Hughie.
And as I was just saying there, one of the things that probably the kind of insight news programme on Radio 1 did do last week was generate a lot of interest in the condition, because it is something that's not generally discussed or talked about. So from that perspective, I can understand you welcoming the media attention. However, the other side of the coin was that they were saying that the increase in colitis and could be related to the amount of junk food that is eaten, etc. What was the view from your side of the fence?
Well, we were bewildered actually by that comment when it was first reported, and then we were quite angry. And following that, our members, and we're a membership organisation, and our members were very cross and took to the sort of social media spaces with some quite critical commentary of the reporting. We were really concerned because there's actually no scientific data or even that sort of mainstream medical opinion that would suggest that young people may have somehow brought the condition upon themselves by eating junk food. And while there might be a number of studies going on regarding diet and how and what you eat can affect certain conditions in you, this information just isn't conclusive. And so of course people were really angry about that message getting out there. And you're right, yes, good. And we're really pleased to talk to you today and talk to other media about Crohn's and colitis and inflammatory bowel disease. But it's not helpful for patients, and it particularly wasn't helpful for younger people with these conditions to have the blame, if you like, proportion to eating junk food.
That's right, because because it is a condition that isn't frequently talked about, people could then think, well, somebody brings it on themselves by eating junk food and not leading a healthy lifestyle. So I can understand lots of people feeling like that. I take it that what isn't questionable is the increase of young people who are being admitted to treatment centres across the country. The figures that they were giving out was that I think it was in 2003, 2004, it was something like 4,900 plus 16 to 19 year olds, and yet last year they were reporting that it had risen to 19,000, which does seem quite an increase. Is there any thoughts behind the reason for the increase?
Well, that was part of the confusion I felt with the story as it was being reported by some media last week, that on the one hand you'd angered a number of people by talking about diet, and you're quite right that a number of people have had very healthy lifestyles and diet all their lives, and so could not ever be attribute those to junk food. But in terms of the numbers, there has been an increase in the number of younger people with Crohn's disease, and we see in the region of 10,000 new diagnoses each year across all age groups. And there is an increase in younger people, but we certainly don't see a jump as significant as was reported in terms of 300%. It's expected to be, I'm told, somewhere in the region of more like 50%. And I think some of the error came about, so I understand it, from the way that some of the cases are recorded in hospitals, and the way that, particularly, say, for example, when some younger people have treatment, they might be under a general anaesthetic, and that would be recorded each time as a new inpatient, and therefore as a new admission. So that in itself is going to increase the numbers somewhat, and you have to sort of dig behind the detail a little bit to have a look at what it means for the numbers of people. But it is true that, first of all, I suppose we should say that we're getting better at diagnosis and understanding the disease. But secondly, the certain aspects of it are being recorded in certain ways which have put the numbers up. But there is certainly a rise in the number of younger people being diagnosed with an IBD.
Right. So, Dan, tell us a little about the work of Crohns and Colitis UK.
Sure. Well, thanks very much. I mean, we're a UK-wide organisation. We have, I think it's now over 30 years service in this area. And what we want to do, I mean, our real aim is to be this really helpful information and support service to anybody affected by these conditions. And that's not just the individual themselves, but also their families as well. And we run a number of family network and support activities. We want to raise public awareness of these conditions and get more support for people with them. There's an estimated 260,000 people with an IBD in the UK, but actually because of some of the diagnosis difficulties and the reporting difficulties, that number could be much higher. And we also want to provide a confidential listening service, which we do, some supporter services through our office in St Albans in Hertfordshire. And we really want to support patients that are going through these conditions with really helpful advice, information leaflets and booklets, access to expert advice. And we also want to lobby for more support and for more healthcare for people with an IBD as well. So that's a really sort of important aspect of what we do, as well as fundraising, which I think you've been talking about on the programme before. We also do a lot of fundraising events, and that money goes to research. And we this year we're really pleased to report that we're doubling the amount of money that we're able to invest in research projects to look at cures and also ways for people to manage the condition.
Right. I was going to ask about research because, as you say, the organisation has been around quite some years, and yet it is a condition, both conditions, that we don't talk often about. So does that reflect in the money that comes your way when it comes to needing money to do research?
Well, we said yes. I think that's a good point, Huey. We do need a lot more money. I mean, there is some considerable investment being made by a range of organisations into research, but to have a really significant impact, this is not a cheap activity to undertake. So, as much if we can raise a lot of awareness, and the members that we've got and supporters and people who live with this, with the challenges of this condition every day, are really fantastic ambassadors for the organisation. They raise awareness and they often raise a lot of money, and we need a lot more of that to be able to do the extensive research that we'd like to do. We have a lot of ambitions to take those forward, and we work with European partners, global partners, and we want to do as much as we can to advance our research. But of course that does take a lot of resource. So as you say, it's quite a challenge when these become conditions that people are concerned about speaking about. Sometimes people are embarrassed to talk about them. And we want to be able to get to a position where people are not concerned about being vocal about these conditions and are helping us to raise awareness, raise money, do more research, doing more for more people. That's the ultimate aim.
And the website, which I've been looking at over the weekend, certainly does give lots of information out that I'm sure lots of people would find so useful.
Oh, I hope so, yes. I mean, go to Crohns and Colitis .org.uk. We've got a lot of our information material. All our information material is there. I hope well arranged so that people can find things easily. There's also the support numbers there that people can telephone to get confidential advice and speak to a number of different advisors through the day. There's also a family network if perhaps parents have a child with one of these conditions and would like to have more information about the support network and so on. And we really try and be the first point of contact for anybody that wants to get more information about either of these two main conditions of an inflammatory bowel disease.
Okay, well, Dan, can I thank you for taking time out to talk to us this morning at Preston FM?
I really appreciate it. Thanks so much, Hughie. We hope that we can talk to you again.
I would welcome that, and what I will do before the end of the programme, there is in our local park, there is a family fun day and family walk coming up soon to raise money, so I will give the date of that out and the contact details before I go off at 12. And I think the information line that you mentioned, is it the 08451 one?
That's right, yes. It's 0845 130 2233, and there's also an email listing as well, and a lot of different information on the website, but you can also call that number and get directed to the service that's going to best suit the caller.
Lovely. Dan, thank you for speaking to you this morning. It's been a pleasure. Thank you.
Thanks so much for your time. Bye-bye.
Bye-bye. Bye-bye.
Thanks for listening to our podcasts. But don't forget, Chat City is live weekdays from 10 till noon on 103.2 Preston FM.